Health Watch West Berkshire. Good morning, Andrew.
Morning, Chris.
How are we doing?
Good. Friday. Shame it's raining, but all in all, pretty good.
Yeah, there's certainly a lot of chat about the weather this morning. So we've got lots to talk about this morning, haven't we? I'm just running through it offline
we
there.
really have, yeah.
Got your survey to talk about. Good practice, the BAME community and the effect of COVID on them, and also care homes as well. So lots and lots to talk through. So what do you want to talk about first?
Well, I just want to paint a quick scenario for people because it might help people understand. So in terms of what we've just been through, it's very much the equivalent of a big city being hit with an earthquake.
Yeah.
So tremendous damage to services and breaking up everyday activities. But what we're in actually is that sort of follow-up phase where we need people to not just go, oh, well, it's gone, it's not coming back, we're fine, we're back to normal, because as everyone knows with things like earthquakes, you get lots of aftershocks. And then you get things like people, get hurt with falling masonry. So that's the picture we're in. And I know it sounds very grim, but we're almost back where we were in February, knowing that this thing is out here in reduced numbers. We're not sure how it's spread and things like that, but we know it's there. And what we do now know is it's incredibly dangerous. We think we're past 60,000 excess deaths. We were hoping it would be 20. So, and it hasn't gone away, and that is the absolute key thing. It has not gone away.
Yeah, indeed. So sobering thoughts, Andrew.
Cheer everybody up on a Friday.
Yeah, thanks very much for that, taking us into the weekend. But I think it's a reality check from Health Watch West Berkshire here.
Yeah,
indeed.
So really, in terms of that scenario, as you would with any kind of natural disaster, what you want to know is, right, what worked, what didn't? How do we find it out? How do we learn from this? So one of the things we've done is we've put a pretty extensive survey up on our website. We can send people paper copies if they request, if they call in and or email us. But it's on our website, on the front page. We'd urge as many people as possible to go fill it in, because what we're going to do with this is once we've analysed it, we're going to send that off to the NHS, send it off to West Berkshire Council, the Health and Wellbeing Board, and let them get an idea of what the actual public think, because some of it's very much sort of practical things, what happened when you rang your surgery and things like this, and others is very much, well, how did it make you feel? More anxious, less anxious, because we've got to try and get both an idea of what worked and what didn't, and also the effect it had on our local population. This huge, disaster happening that we've never been through before, and that was one of the key things. No one's ever been through this before in living memory, so we don't know the best way out or the best thing to do or what they did when it happened in 1960 something, because it didn't. So we haven't got that to fall on, which we often do with disasters that hit the country. So the survey, very, very important. I'd urge people to go fill that in, and your family, your friends, and let's get as many responses as we can, because the more responses we get, the better the data, the more we can read from it. Yeah,
indeed, and that helps for the future, doesn't it?
Plan really, really does, because we got lots of things right. The community's response was incredible. The people of West Berkshire should be so very, very proud of themselves. Lots of people stepped up, companies stepped up, individuals stepped up, people repurposed themselves. We had people making sanitizer, we had food parcels being delivered, prescriptions being delivered. It was just phenomenal, and it was funny, the community response frankly got going quicker than the sort of national response.
We did, very much so. We were well ahead, at least a week ahead, if not 2 weeks ahead of elsewhere, and even central government sort of plans.
Absolutely. So that was an absolute positive, but we need to look at where things didn't work quite so well.
Yeah, of course.
And see what we can do. So the survey, very, very important.
Yeah, clearly is. And we're still going, of course. I mean, we talked about this perhaps in the past tense, but all this stuff is still going. The food parcels, the volunteering. I know a lot of people return back to work, but this is still going on. This is not, it's a marathon, not a sprint, as someone said to me the other day, and it very truly is. So that's the survey. So certainly we'll signpost to that and get our listeners and encourage the listeners to encourage others to fill in the survey, which is dead easy. It's on the front page of the website, as you say. So also you want to talk about good practices, Andrew?
Yeah, well, I think if I could make people think we're back in February, a little bit warmer, but back in February, where we know this thing, COVID-19, coronavirus, is out there. We've heard it's deadly, but, the numbers have dropped because obviously the numbers of people who are now carrying the virus have dropped because of lockdown. The daily deaths are sort of at 135, which is still far too high, but there's still quite a lot of people testing. But what people shouldn't be thinking about is it's gone away. So if we were back in February, we'd be thinking about, right, have I washed my hands? Have I touched something? Have I got my hand sanitizer? It's a bit like when you go out. Now you're going out, it's, well, I need my wallet, I need my phone, my door keys. You still need to be thinking about hand sanitizer, washing your hands regularly, or when you come into contact with stuff, or if you've picked up a plastic bag from somewhere and things like this, when you get back, wash your hands. And also, I think the other big one, Chris, is face coverings.
I was just going to ask about that. What's your views? What's the view on face coverings, face masks?
There's a fabulous piece the Financial Times has done about different ways to protect yourself. And, the risk, in theory, without a face covering is around about 17%. And with a face covering, it drops to 3%.
There you go.
And, of course, what you've got to think about is it's not necessarily about protecting you. It's the person you're talking to, the person behind the counter, the person at the hospital, at the GP surgery, because you may be asymptomatic and it may not hit you badly, but the person you're talking to, it may absolutely floor them, or they may then pass it on to a vulnerable person.
Yeah, of course.
So, to me, although they've made it compulsory on transport, really it should be a bit like putting your mobile phone. Have I got either a disposable mask that I can take out, and when I'm in confined spaces, make sure I'm wearing one, or a fabric mask that I can wash at 60 degrees once I get back. I mean, ideally have 2 or 3, because then one in the wash, one in your pocket. Yeah,
and one in use.
And one in use. So I think the evidence I've seen, and from people like Professor Tricia Greenhalgh at Oxford, it's irrefutable. And even if it's only a few percentage points, well, those few percentage points are lives.
Yeah, indeed, they could
be. It may not be yours, but it may be someone else's, or it may be a key worker.
Yeah. Any other tips, Andrew? So obviously washing the hands, using hand sanitizer, I guess, and also then face coverings. But any other tips under gun practice?
Well, I think the other thing as well, which we're really wrestling with, is distance.
Yeah.
Because again, the FT article has sort of said, the risk at sort of 1 metre-ish is about 12%. At 2 metres, it's 2. It really does make a difference. And it's not just distance, funnily enough. The risk levels indoors are higher than outdoors, because they still aren't entirely sure whether this is droplet-based, where effectively the distance that the droplet takes to get from someone's mouth onto the floor, does it hit you first or not? And that's where the 2 metres comes in. Or if it's actually small aerosol droplets that drop slower. So ideally, people should always be kind of 2 metre-ish apart. Also, the other factor, and this is one of the difficult things with coronavirus, is the risk is not binary. So it is not just the distance. It's the distance. It's also the size of the room you're in, the length of time you're in the room. One of the things that appeared to happen when it first broke out in China was there was quite a lot of medics, got fatally ill in some cases.
Yeah.
And it was felt it was because they were within such high concentrations of the virus for so long that relatively healthy people, were coming down with it. So it's a sort of range of factors. It's a bit like, you get into, you get your car keys, you've got your wallet, you've got your mobile phone, I'm putting my seatbelt on.
Yeah, it's all those things.
The equivalent of putting your seatbelt on is probably having a face covering of some sort, and also probably keeping 2 metres apart from people as often as you can, or limiting the time you're actually with them. Because
indeed, that's a key thing too, isn't it?
The longer you're with someone, or talking with someone who you're not clear, isn't part of your household, you're not completely sure, They may not have been tested. And I think testing is the other big one, Chris. I nearly forgot this, my Lord.
Yes, indeed.
I think there's a new testing centre opening for local residents. I think I heard the showground.
Yeah, it's already open, actually, at Newbury Showground, yeah.
It's already open.
Yeah,
so there we go.
Yeah.
So we have all these things happening, and testing really, really, really important, because if you think you've got some of the symptoms, and remember the symptoms can be persistent cough, raised temperature, loss of sense of smell or taste. Also, there's potentially, people talk about COVID toe and potentially rashes, but it's worth ringing 111 and potentially getting this booked, because there is capacity there.
Oh yeah, there is.
And of course,
yeah.
When you get your test, you then know, have I got it, haven't I got it? And it really doesn't matter how you feel. If you've got it, you should self-isolate for 14 days, because remember, you may well pass this on to someone who may well get. Even yesterday in the fatality figures, there was a 13-day-old baby with no underlying conditions.
I know that was very sad news last night that I heard. Yeah.
This is not just it'll only affect some old people. It won't affect me.
Mm.
It's thinking on that it may not be you, but it may be a key member of your family, a key member of the health service, a key worker who's just going to work, doing their job, driving the buses, serving you in the supermarket, and you could be, pointed a loaded gun at them.
Yeah, you could be. Yeah, indeed. So very sobering thoughts and very good advice. Thank you, Andrew. So I know you, just in the time available, just so we make sure we've got time for this, you wanted to talk about the BAME community and obviously the significant effects that this has had on them.
There's a big report out that's about to be peer-reviewed, but they're pretty solid. And they think that the risk to certainly the South Asian community of those who go in hospital is 20% higher of dying than the rest of the population. And I think there seems to be, to me, some real confusion about what's been going on with the sort of Black Lives Matter campaign. And I think it's almost one of these things that actually the Black Lives Matter campaign is missing a word at the end. It's called also, because people think it's one or the other. But when you've got all these, it's incontrovertible additional deaths in the community, often from people who are providing these caring services or in the hospitals or whatever, it's clear that we should make an allowance for it. We've done this with, skin cancer and sunscreen and things like that. So I think it's really important that people understand the risks, and in the same way we're going to have something with face coverings with some disabled people can't wear masks.
No, indeed. Yeah. Yeah.
And we did have people who were being abused for being out when allegedly they were exercising, but because they've got hidden disabilities. So people have got to be more thoughtful.
Yeah.
They've got to think that the risks are not level for everybody. And I think we've just got to engage more and look at some of the surrounding issues about this. It's so complex, but it's clear that people from the BAME community who may live in more deprived areas, who may work in allegedly lower skilled jobs sometimes, their risk levels are so much higher. So we should be making adjustments, and I know this is now happening.
Yes, it is, isn't
certainly
it?
Certainly in health and social care. But I think people just need to be mindful themselves and say, well, what can I do?
Yeah, indeed, you're right. Because that 20%, 20% increase in risk is just a massive increase, isn't it? Compared to.
Well, you wouldn't say, well, that then push them to the front, or let's put them in an area of high risk. You'd be going, let the people with the lower risk shoulder some of the lifting here. So I just think, honestly, we just need to be kinder.
Yeah.
We just need to be more thoughtful. Everyone as a community has taken on this COVID challenge, and some stronger than others. I know we're going to talk about care homes, and my Lord, care homes really hard.
So let's come on to that, Andrew. Just the time available, just to come on to the care homes and your thoughts on that, because it has been the hardest hit. It's made the news every single day during the pandemic, hasn't it? Well, certainly the latter stages.
It really has, and some of it was really obvious that the risk of the virus is higher again as you go through the age group, and often people have got multiple conditions, and just because the nature of them being cared for in confined environments and things like this, you could see why it was always going to be a problem. But if you listen to the BBC Radio 4 More or Less programme from Monday, they were talking about the actual risks. And I think they said something like the general population is about 1 in 2,000.
Yeah.
And then you get down to care homes, and it's 1 in 13.
Yeah, yeah.
And I don't think I've ever heard a more sobering, sort of statistic to bring something home in terms of risk levels changing. But what we've got to do is we've got to now say some of these people haven't seen relatives or anything like this for a very long time. They haven't had a huge amount of contact. They're living in this PPE-led environment. You know, in some of the homes, the communal areas are all closed off. And we already had issues of social isolation and things like this. So what I'm hoping is that we're talking with the authorities about how we can arrange potentially sort of opening up contact. And I don't necessarily mean physical contact, but, you know, ensuring that people have got the ability to use tablets and talk to people and things like this. We're also going to be running a specific care home survey, Chris.
Oh, right, okay.
Where we're going to be interviewing the residents down the line. Yeah. And also, and I think this is really key, we want to speak to their families. Yeah, well, that's an important part of it, isn't it? You know, how did they... And that's a really important one, to get their view. Their views, yeah, I agree totally with that, yeah. Of you know, what do you think's worked, what hasn't worked. But we're really sort of hoping that you know, this emphasis on keeping people safe, but equally ensuring that their mental health doesn't suffer. We've had this amazing PPE drive from the community for the hospitals and things like this, and yet, you know, very few people said, well, do you think the folks in the care homes might need some help? Yeah, indeed. And I know, you know, we do get this argument that, well, they're private businesses and things like this. Yes, but if they can't get hold of it because everybody else has been chasing it down, or the NHS has got priorities, how are they going to do it? They still need it. Their staff need it. You know, their staff are heroes, and they are you know, seldom talked about. Yeah, they are really frontline as well, aren't they? In the same way that anybody else in the NHS. And they are absolutely, you know, in the front line as all the NHS folks are. And of course, while they've always had to worry about infection control, you know, these are not ICU specialists. No, not at all. You know, these are care assistants and things like this who go in because they care about people and they want to improve people's lives. And all of a sudden, you know, they're being turned into ICU sort of style infection specialist. That's right. They've stepped up to this, and no idea that's going to be the case. We're going to run out of time, I'm afraid, Andrew, on this very useful, very sobering interview, but lots of very good information here. Thank you very much for coming on this morning. I think just run over those can we just run over those good practice points again that you were saying people must do? So I think again, you know, let's make sure we wash our hands every time that we're coming into contact with either, you know, a different environment, different surface, or if you've got some hand sanitizer, just make sure you've got it in the car, in your pocket. I think the case for using face coverings, certainly in any confined situation, is almost, you know, without contravention. And so I think, you know, making sure you've either got a disposable one with you and make sure it goes in the bin, in a sealed bag. You know, don't just leave it lying around, or, you know, get some fabric masks, or make some fabric masks. You know, very easy to make, and just make sure you wash them at 60 degrees and keep one spare and one in the wash and one. Indeed, yeah, and then last but not least, keep your distance is the key message here from you as well. I think you know, although they're saying, you know, perhaps we can reduce this, the risk factor rises so dramatically, both the closer you're in contact with people and also the length of time you're talking with them, you're interacting with them. So, you know, the guys who've been out in the parks and on the beach, you know, you start to forget, well, I've been with this person half an hour. Yeah, that's it. If I'm a metre away at half an hour, my Lord, the risk level rating is so different from if it was 2 metres and 5 minutes. In a couple of minutes, yeah. You know, it's negligible then, but at 1 metre and half an hour or an hour, and this is what people are starting to see on social media, you know, people who've been to parties and things like this, or barbecues and things like that, because you do sometimes just forget. Yeah, you do. It's a natural thing, you know, with humans at the end of the day. You've got to have it in your head. Yeah. No, good advice. You may have it, or the person you're talking to may have it, and if you just keep those sensible things, because if we do this for a little bit longer, you know, the freedoms that we're allowed will unlock, and if we don't, we will go down into localised lockdowns.
Yeah, and that's the last thing we want. Andrew, I'm afraid I have to cut you off there. Thank you so much for calling in this morning. That's very good advice and a very good overview as well of what's happening.